Hi, everyone, and welcome to Brush Up, presented by Oral Health Group, the dental podcast where we speak with industry experts about the forces shaping dentistry, from technology to practice management. I'm your host, Dr. Daniel Richmond, an orthodontist based in London, Ontario. In today's episode, we'll be exploring whether dental practices can reduce their environmental footprint without compromising margins, or does sustainability come at a cost? Joining us today is Dr. Laurie Houston. Dr. Houston has been a general dentist since 1985, owned her own practice for 27 years, and now associates 2 days a week while also providing access to care at an Indigenous community in the Georgian Bay Area. She is past director of the ODA, past chair of the ODA Environmental Sustainability Working Group, and lead author of the Sustainable Dental Toolkit for the Canadian Coalition for Green Healthcare. Laurie has lectured extensively on sustainability in dentistry across North America and has written multiple articles in several journals on this subject, including oral health. With her charity, Can Help Through Healthcare, she leads small dental teams to developing countries to provide access to dental care several times each year using sustainable protocols and Canadian reusable products that respect patient safety and infection control. Welcome, Dr. Houston.
Thank you so much, Daniel.
All right, so my first question for you. You've called climate change the greatest health threat of the 21st century. Why should this matter inside a Canadian dental practice, not just at a global level?
Well, we are currently living in an era where we have crossed 7 of 9 planetary boundaries, and this is based on sound science from eminent experts from across the world. Our planet is warming, and this is amplifying health risks. It may surprise you to know that healthcare, in fact, contributes up to 5% of total greenhouse gas emissions, and that's twice aviation. This is not an abstract ethics question. It's directly related to community health, business continuity, and professional responsibility. I doubt that there's an area in Canada that hasn't seen either wildfires or flooding or drought or heat waves, and many have seen 2 or more of these in succession or simultaneously. In 2021, British Columbia dental offices had to close or either severely limit their hours of operation due to the intense heat dome effect they experienced. They had to protect their patients and their staff. Wildfires have become increasingly problematic across Canada since the early 2000s, and our forests are emitting carbon. Permafrost is beginning to melt, and it's also releasing carbon dioxide and methane, which is a very potent greenhouse gas. And our north is warming at 4 times the global average. Canada is warming faster than the global average. Glaciers are melting at an unprecedented rate as well, not just in other parts of the world, but also in Canada. And this is affecting usable drinking water. So, how we all consume resources and utilize transportation is important. We all have to be part of the solution to this ever increasing global existential problem. The World Economic Forum indicated that climate change is actually costing $16 million an hour in terms of costs from the damage of extreme weather events.
All right, thank you. So, where do emissions in dentistry actually come from? And what do most dentists misunderstand about their environmental footprint?
Most emissions come from transportation of our patients and staff. According to a study that was done back in 2014 in the UK, this is about 60 to 65% of our emissions. Procurement or supply chain is about 19%, and energy use is about 7 to 15%. However, this may be erroneous, and supply chain may be much higher based on what are called scope 1, 2, and 3 emissions. Scope 3 emissions are essentially supply chain. They are not well understood and they are not well measured. They may, in fact, be up to 88% of the emissions of our offices. And I find this is important to mention to our audience so they understand the significance of the CO2 emissions from supply chain. But CO2 emissions are only part of the equation. We are also using all kinds of single-use plastics, and these are all made from fossil fuels. These are destroying our land and water systems. They form microplastics and nanoplastics when they disintegrate. They never go away. They're in every part of our world, the most remote corners. They're in the deepest part of our sea. And on top of that, they're in all of us. Yes, these particles are accumulating in all of our organs, including our brains, and they are increasingly going into our brains at a higher rate than our other organs. So I think you can see this is a new, just recently being studied existential problem that is also part of the equation with how we use things in dentistry. Most dentists are uninformed about their environmental footprint. And I get it. They're concentrating on running a practice. And that's really, really difficult in this day and age. They probably don't realize the impact of transportation and supply chain. Most of them likely understand recycling. It's a myth. Most plastic does not get recycled. Only 9% of plastic gets recycled in Canada, and that's a true statement for the global average as well. And landfill sites are increasingly becoming filled to capacity across our country. And these microplastics and nanoplastics can leak out of our landfills and affect our drinking water supply. Additionally, I doubt that most dentists realize that composite restorations are an amalgamation of glass and plastic. They all subsequently cause environmental pollution as they break down. And plastic materials that we introduce into our patients' mouths are shedding microplastics and nanoplastics. Additionally, dental chairs can use up to 3 gallons of water per minute, a high rate of consumption. That probably goes unnoticed during operations. It's why I tell people to use dry vacuum suction units instead, because they're environmentally superior and they will save you money over time. I want to make it clear to dentists too that they need to watch out for greenwashing. Many companies are touting their products as being eco-friendly, which is an undefined term, essentially. It doesn't necessarily mean anything. Compostable and biodegradable are also terms that are thrown around quite a bit. Something is not necessarily easily compostable. It may require an industrial compostable facility where specific temperatures and pressures are required to compost it. Additionally, biodegradable can simply mean that a product starts from being a plant-based material or that it has an additive that makes it break down faster. But it doesn't necessarily mean it breaks into something inert. It could break down into microplastics and nanoplastics, even if it is so-called biodegradable. So this is why I am really stressing the need to move to reusables in healthcare.
So, with dentists already facing rising operating costs, where does sustainability genuinely add expense and where can it reduce costs?
So if you are trying to shift to being a greener practice, you will have higher initial capital costs because you're going to choose energy efficient equipment and supplies. You're going to use renewable energy, and you're going to switch to other things such as reusable PPE and sterilization products. These will all cost you more upfront, but they will pay for themselves over the course of their lifetime. For instance, if you have renewable energy with solar panels and a battery pack to back it up, then you can still function if there's a power outage. And if you have a battery pack, you can gather energy when hydro is at all-time highs during operating hours in the middle of the day and use that energy at a much lower rate. Diesel fuel is also going up in cost because of the Iran war, and I don't see that situation changing anytime. Stainless steel high volume suction tips can also be used in your office. These never wear out. They'll cost you more upfront, but they'll save you money in the long run. Environmentally responsible oral care products, on the other hand, are from small companies, and things like bamboo or maplewood toothbrushes will cost you more, or silk or corn-based flosses in environmental packaging. But the flip side of this is that these companies are predominantly Canadian small startup companies. And right now, we are under serious economic threat from our neighbors south of the border. We're being punished with large tariffs. So all of us have to do our part in terms of supplying, helping prop up our Canadian economy. And we can do so in a way that is also responsible in terms of the environment. There are companies that will recycle PPE, but currently this is up to the individual dental office to pay for that expense. I've already mentioned I'm not a large supporter of single-use items, but the Canadian companies that create the reusable products that you can use 75 or 100 times also can allow you to courier those products for recycling back to them. In both cases, I feel that we need to have more government support for individuals who want to do the right thing, but feel like they're being economically challenged in doing so. This leads me to talk about extended producer responsibility. It's time that our manufacturers and suppliers take on the role of paying for the end stages of their products, the disposal. Unfortunately, this will only occur if it is mandated by our regulatory bodies, because everyone needs to be on a level playing field, dentists, manufacturers, suppliers alike.
So, do you think it's realistically possible today to run a dental practice that is both environmentally sustainable and financially strong?
Absolutely. In fact, green dentistry practices report having lower operating costs because they're reducing resource consumption and waste while also mitigating travel footprint. They're also attracting eco-conscious patients. The younger people in our population are actually suffering from eco anxiety. A lot of them are really worried about their future. Some of them are choosing not to have children. They're so worried. So you're going to attract these kind of patients to your office if you're running a sustainable practice. The other part of this equation is attracting staff. Most of our staff are younger, and you're going to also attract more staff and retain more staff if you're running a sustainable practice.
Okay, thank you. And what are the biggest barriers to adoption right now? Is it cost, time, knowledge, mindset?
Let's unpack these one at a time. So, there is a misconception that running a sustainable dental practice will cost you more. And I've already indicated that's not true. If you are going to introduce sustainable protocols into your office, obviously that's going to be more time consuming at the beginning, such as it is with any new protocol that you introduce into your office. But once you've started going digital and reducing waste and using reusable items, you can increase efficiency quite quickly. You are reducing material preparation. You can change from handling a lot of garbage to washing reusables. It can all become more efficient. Knowledge is by far the biggest barrier to running a sustainable practice. There's a lack of formal training and education, including in our dental schools, sad to say. Over 60% of dentists feel they have no information about how to run a green office, and most professionals are unaware of what they can do. They're unaware that their biggest environmental burden is the use of single-use plastic items and waste mismanagement. Furthermore, they falsely believe that running a sustainable practice and choosing sustainable reusable items will violate safety protocols, and that's not necessarily the case anymore. We have Health Canada approved reusables now. Mindset, much like knowledge, is another big barrier to choosing a sustainable office. Human beings do not like change. They simply don't. Dentists are no different. And there is a mindset that green is not clean, when in fact it can be the safer choice. Let me give you an example. Single-use polypropylene masks that we wear on our faces shed thousands of microplastic and nanoplastic particles right up our noses. And studies have actually indicated, peer-reviewed studies have indicated that they could be a health hazard to us, the healthcare professional. They're also covered in forever chemicals as a moisture barrier, so-called PFAS. The Health Canada approved reusable masks that are now available to us do not have PFAS on them. They rely on mechanical superior protection, and they shed far less plastic than the single-use models do. I view single-use masks in an entirely different light now, and I choose not to wear them. The disposability mentality that we have currently in dentistry has got to change. The Journal of the American Medical Association came out with an article in 2023 that stated that there is an absence of substantiating evidence that single-use disposables in healthcare reduce healthcare acquired infections. That's an incredibly powerful statement.
And so in Canada specifically, are there unique barriers or opportunities when it comes to sustainable dentistry?
Absolutely. Unique to Canada is our vast geography, which can lead to supply chain issues and transportation needs. Additionally, we deal with a cold climate energy profile. So both of these can increase our emissions and our operational risk. I've already mentioned the lack of education in our institutions, and this really troubles me. I really don't understand our educators. They tell me they don't have time to introduce sustainability into the curriculum in our dental schools. What could be more important to these students, their future families, our country, and the planet? I lecture students at the two universities in Ontario for 1 hour when invited to do so. But this is very limited and it's at the end of their school day when they're tired. It's not mandated. It's a voluntary lecture. So attendance is limited, but I keep trying. Furthermore, our rigid infection control protocols leave dentists and hygienists alike genuinely afraid to try and adopt anything sustainable. This is including the Health Canada approved PPE and reusable sterilization products I previously mentioned. We have all of these wonderful products available to us, made right here in Canada. I actually don't understand as well why our IPAC protocols across provinces are different. Pathogens don't recognize these barriers, not in provinces and not in countries. It's crazy. Unfortunately, there is a lack of incentives and subsidies right now for sustainable technology and energy in Canada. Hopefully that will change, but this is still a barrier to dental practices moving to more sustainable protocols. And while all this is going on, fossil fuels continue to be subsidized.
And so how much responsibility should fall on dentists versus manufacturers, suppliers, and regulators?
Okay, well, I want to go back to your other question right now first, and then I'll answer that. I'm pleased to announce that IPAC Canada has come out with an official statement emphasizing integrating environmental stewardship and sustainability into our IPAC protocols. They're looking at risk-benefit analysis, sustainability teams in our offices, reprocessing of medical devices. Yes, you heard me. Reprocessing of medical devices, and holding manufacturers responsible for the life cycle impact of their products, and looking at innovation in terms of pollution production. For far too long, we have been focused on reducing infection transmission to zero. This is virtually impossible. It is not looking at the big picture, which is all the unmitigated plastic waste we are creating. I salute IPAC Canada for this sustainability endorsement, but talk is cheap, and it's time we act and change our protocols meaningfully. Unique to Canada are the amazing reusable products I've already mentioned. Most of these are made from small startup companies coming out of Quebec. I salute these innovative companies. They are doing what needs to be done for not only the future, but now. And I'm also pleased to announce that the Canadian Coalition for Green Healthcare has come out with a very fulsome toolkit for dentistry. It's full of sourcing sustainable products, materials, and energy. COVID has also taught us that we can use teledentistry to help our patients. This can be used for diagnosis and for follow-up, particularly for patients who have a hard time getting out of their houses or for communities that are very remote with limited access to care. This can provide a service while mitigating environmental impact, obviously with the constraints of a virtual platform. So getting back to your other question, how much responsibility should fall on dentists versus manufacturers and suppliers and regulators? Well, we all have to be part of this. It's a collective responsibility, and we all have to collaborate on this issue. Dentists can change their operational protocols, and a lot of young dentists are. I just interviewed one the other day who's done some incredible things in his office. Manufacturers and suppliers are the drivers of innovation, and they need to be spending more attention on sustainability in terms of innovation. Our regulatory bodies set the standards that we practice dentistry at, and these need to be based on real science, not just so-called expert opinion or the precautionary principle. The precautionary principle, ironically, was originally introduced to create environmental protection, not to have us using all these single-use plastics. Our educational institutions and our associations need to provide knowledge for practicing dentists and students alike. Ultimately, the goal should be shifting dentistry to a circular economy where materials are reused whenever possible and not discarded after one use. The entire system has got to stop rewarding a disposable design. Manufacturers and suppliers need to start measuring the impact of their products. This is starting to be done with life cycle assessments, such as what the Canadian company that produces the PPE and sterilization products has already done, and you can see it on their website.
And what are some low cost, low effort, high impact changes every dental practice could implement starting tomorrow?
Lots, lots. Stop using paper tray covers. They're not necessary. They're not sterile. They make absolutely zero sense. You should just wipe down your plastic, or I prefer metal tray, with a hospital grade or better disinfectant. You can use ice pencils. Dr. Glassman is an endodontist who lectures all across North America, and you can take the plastic coverings off of your needles for injections and sterilize them, fill them with water, put them in the freezer, and use them to check for pulp vitality. They're more effective, according to Dr. Glassman, than the aerosol can sprays that are used. You can stop using plastic barriers unless your regulatory body requires it specifically. There was a study done where medical tables being wiped down by staff, they did a much better job wiping down those medical tables if there was no paper cover on them. So I think you can make the transition into our equipment. Stop giving out bags for toothbrushes and toothpaste. People can stick them in their pockets or their purses or their knapsacks. And stop using cups all the time for your patients. We don't do this in the office I practice in. We only use cups for medicaments if we need to before or after a procedure. You can dial down your electronics at night, shut them off, use LED lights to replace your bulbs. You can adjust your thermostat in winter and summer to reduce your energy impact. You can use the stainless steel high volume suction tips I talked about. You can purchase your prophy paste and your fluoride varnish in bulk rather than in single use increments. This will actually save you 50% of the cost of those single use items. And you can use responsible receptacles that are stainless steel to put your prophy paste in. And you can use a cotton pellet to apply your fluoride varnish. It's a simple change. It'll save you money and it'll help save the environment. And you should buy in bulk. Really plan out your supplies and what you need to order. So you're only doing this as infrequently as possible to decrease your transportation footprint. In the UK, Henry Schein has now implemented a surcharge for small orders. That could come to Canada, but let's be responsible and do it proactively. And you should have reusable cutlery and dishes in your office so your staff can bring their leftovers to work instead of having to buy something in plastic. And you should also encourage the use of tap water over bottled water. In 1 liter of water in a plastic bottle, there are 300 microplastic particles, 240,000 nanoplastic particles, and that water is not tested to the same specifications of our municipal tap water. So I could go on, but those are quite a few changes you can implement.
Those are great. Thank you. You emphasize prevention as a sustainability strategy. How does preventative care reduce environmental impact in real terms?
I can't emphasize enough just how important prevention is. It minimizes the need for resource-intensive restorative treatment and therefore reduces energy and material consumption while also decreasing travel footprint. Reducing what is essentially an avoidable disease reduces upstream extraction and waste, including plastics, and it actually improves patient outcomes. Routine checks, fluoride applications, and using teledentistry can all be used to minimize more carbon-intensive care. The other thing I want to mention is that we used to have, back in the day when I was a kid, we used to have prevention education right in our public schools. Someone came to my school and showed us how to brush our teeth. They gave out disclosing tablets, and I can tell you, I wanted to make sure every bit of that red was off my teeth. It's a very effective time to grab the attention of our young people when their brains are sponges and will actually use this knowledge. It's far harder to reform our older patients. It's such a simple and cost-effective measure. It should be reintroduced.
As an orthodontist, I'd love to get your thoughts on clear aligners from a sustainability standpoint. They've become a huge part of orthodontics, but they do rely on single-use plastic. Do you see any realistic ways clinicians can minimize that footprint without compromising treatment?
Well, I'm going to start out by saying, Daniel, I am not a fan of aligners at all. And there's quite a few dentists and orthodontists who are not as well. I'm sure you're probably aware there are lots of peer-reviewed articles that indicate they don't produce adequate occlusal contacts. They do not control teeth torque or retention as well. They do not significantly correct class 2 or overjet situations, even after wearing elastics, our patients wearing elastics for 7 months. They are not the gold standard, and they do not have the mechanical control that fixed braces do. Additionally, they are made in developing countries where labor is cheaper, and then they are flown to countries such as ours, developed countries, further increasing their footprint. If you want to use this modality of treatment, you can decrease your footprint by using an intraoral scanner and having a digital workflow. 3D print your aligners on site, which is something some orthodontists are doing now. This has been shown to be more accurate, and it can diversify your thickness from the front to the back of your aligners so that you can play with the occlusal plane. And you're using less plastic because you're mitigating the need for models. They're no longer necessary by going with this paradigm. You can consider getting them recycled, although I've already mentioned that plastic recycling has all of its own inherent footprint issues for the environment. There is a company in the US that would love to have aligner material, but they have to charge a tipping fee. And my understanding is aligner companies won't do this right now. So lots of things you can do. You can choose also not to have as many the sets of aligners shipped out at once. Quite often, and I'm sure you realize this, your treatment plan doesn't go as planned. And so there can be aligners that are no longer of any use and they just get thrown out. So try to mitigate that by having some common sense with aligner shipments if you're using a third party to create those aligners. You can also use a producer who is very responsible with minimal packaging. And there is a company out of Boston that has so-called biodegradable aligner material. But unfortunately, Mark could not confirm for me that that material doesn't break down into microplastics or nanoplastics as well. So there are lots of problems with aligners. I will say that it's not a modality I choose for my patients or the planet.
Got it. Okay. Thank you. Those are good tips. Last question for you. Looking ahead, will sustainability become a competitive advantage? And what will a truly sustainable dental practice look like in 10 to 15 years?
There is no question that a sustainable practice will be a competitive advantage for some of the reasons I already mentioned. Resilience and trust and being credible in terms of sustainability will become increasingly important to your patients, your staff, and your insurers. That's right. Insurers are looking at the big picture with sustainability. Their rates have gone way up because of all of the extreme weather events and all of the subsequent destruction of infrastructure. The deeper message I want to send everyone is that right now we're on a trajectory where we will bypass the 1.5 degrees C that we all were trying to agree upon at the Paris Accords. Right now, we're heading towards 2 degrees C of planet warming. If we get up to 3 to 4 degrees of planet warming, that becomes unlivable, truly unlivable. Our planet will destabilize. So we need governments and policymakers and the industry to all come to the table now to stop this trajectory. We did this globally back in the 1980s with respect to the ozone layer. We realized that our ozone layer was depleting and becoming very, very dangerous. And so everyone got to the table and we stopped using the harmful chemicals that were destroying our ozone layer. Interestingly, ozone layer is one of the two planetary boundaries that is currently in the safe zone. Patients are becoming increasingly environmentally savvy, and up to one-third to half of your patients, especially in younger demographics, will demand and actively choose a sustainable practice. And this will also boost staff involvement and morale. It'll be easier for you to recruit and retain staff. And you can market your office as sustainable and differentiate yourself from your competitors. And this will also future-proof your office for when government regulations with respect to waste mismanagement tighten up, and they're bound to. A truly sustainable office in 10 to 15 years, well, it will have a digital and automated workflow. It will minimize all waste, including plastics. It will employ teledentistry for initial diagnosis and follow-up. It will integrate AI into diagnostics to enable earlier and less invasive and more accurate treatment planning. It will be prevention focused, not disease focused. It will produce restorations on site with 3D printing and hopefully move to truly sustainable materials that do not harm our patients. And it will employ circular packaging where our suppliers will actually have take-back programs and hopefully use truly compostable materials. It will use renewable energy such as solar or wind and smart technology to maximize energy efficiency. And it will use a waterless vacuum system and LED technology such as handheld LED wands for giving local anesthetic. That's coming down the pipe very shortly. And it will use paperless records, sustainable, reusable building materials, and active or public transit and EVs instead of combustion vehicles. I have a dream that dentistry can move from a resource-intensive profession to one that is a leader in sustainable healthcare.
Amazing. Dr. Laurie Houston, thank you for joining our podcast. And to our viewers, thank you so much for listening. Be sure to sign up for Brush Up podcast alerts or subscribe on Spotify and YouTube to be notified each time we post a new episode. Keep brushing up.